I've always been interested in how the brain works and how psychology and emotion interact with the brain. And with the help of St. John's Hospital and with the help of the University of Utah, we were able to start the Institute for Cognitive Health in 2009. Since then, we've been able to see a number of patients about their memory problems. Our goal is to try to keep people out of institutions as long as possible and keep them in their homes. What month is it?
This is April going on to May.
So a lot of people ask, what is neuropsychological testing, which we do here? What it involves is a very extensive interview process of asking people about their day, how they're spending their time, are they being productive? And then I do a neurological exam to see if there are any signs of previous stroke or Parkinson's disease or something that might be affecting their brain.
We didn't even really know that there was a science of cognitive health. I mean, in terms of looking at specifically a doctor that works with aging people. We've been doing exercises, taking exams, and looking at the cognitive tests over time and whether they're improving, which they have been. So for us, it's been great.
I have senior dementia. There may be a way to stave this off a little bit, and she's giving me medicine that's an anti-depression kind of a medicine, and it's made a huge difference in my life. I hadn't even realized that I had moments of depression. I just thought I was too tired or something. It wasn't that at all. And so I feel generally good 99% of the time. And I do hand that all to Martha.
My diagnosis some years ago was MCI, minor cognitive impairment. The Institute is advising me on what kind of medicine I should not take and which one I should take. They've been very helpful.
This is a disease that robs you of who you are. Our goal is early diagnosis, early intervention, because there are things you can do to prevent this disease. We end up doing a very holistic approach. Exercise is huge, and there are amazing studies to show that you actually can develop new brain cells. Nutrition, eating these nutrients, and not in the form of supplements, does reduce your risk for developing Alzheimer's disease. Socialization, keeping the brain active, constantly learning anything completely new.
As a primary care physician, I always refer my patients with early dementia, late dementia, wherever they come in, to Martha Stern's clinic. The research, the cutting edge treatment, all of it is right here in Jackson.
My wife, Michael Ann, she was diagnosed with MCI, mild cognitive impairment, about 4 years ago. Dr. Stern, she obviously knew a lot about cognitive impairment. We just really liked her. She had just a tremendous bedside presence. They also had resources. They had a nurse and a social worker, Carol Taylor, who was absolutely outstanding.
What we do here is the team approach. Our social services department gets the patient out, has companions come in and take people out to dinner, take them out for walks, and gets them involved in community activities.
Dementia or Alzheimer's never affects just one person's life. It affects the circle of people around them. We do a lot here in our team approach to work with patient and family education, emotional and psychological support, providing help in a support group setting, which is so very powerful to sit in a room with other people that are on this journey of dementia and know that they truly understand what you may be sharing that's happening behind closed doors in your own home.
It's very helpful to me to be able to sit down with Martha and Carol and the others and talk about my aunt and what she's going through and what we can expect, and just be prepared for the kind of long, slow decline that you have with Alzheimer's.
The most difficult part is witnessing families that experience on a daily basis the loss of one they love. Dr. Stern and I often say, we're so grateful that we're here for these people to companion them through that.
When we first went in to see Dr. Stern, they gave Mom a mini test to see where she rated. That's when they were able to give us the diagnosis. It's tough. I know that there's There's some tough times and some bumps in the road ahead, but I feel like we've had the best care we possibly could with Dr. Stern and the Institute of Cognitive Health.
You know, the Institute is just tremendous at creating book clubs, awareness within the community, putting a name and a face to dementia. They've really helped to support both families and the patients.
We created a curriculum that was designed for professional care companions, not family members. This 22-hour training course was focused on specific techniques that these caregivers can use in communication, in helping with grooming and hygiene. What can we do to help someone who no longer remembers how to feed themselves? Sharing this information can remarkably enhance quality of life for families and those with advanced dementia exponentially.
In 2009, I started working with a woman who has early onset Alzheimer's here in Jackson. And I became a sort of companion caregiver for her that year. It's very rewarding, and it's different than anything I ever saw myself doing.
The Institute can help us with different methods to help take care of people, and we as caregivers want to give them a safe environment, we want to take care of their needs, but we want to give them dignity and deserve to have that to the end of their life.
I think my greatest message is this, that people are not alone, that resources are available, that we are very accessible. And with the incredible multidisciplinary care team approach that we use, we really can be pretty much one-stop shopping for families as well as patients.
I think it's an absolute miracle to be in a town this small and have somebody the quality of Martha and the intellect right here around our corner is amazing and wonderful.
If I have a plea to the community, it is to people who enjoy this community would stay here and take advantage of all of the resources that we have, this being an important one in the lives of so many of us.
See, there's quite a few people who have memory loss. I'm very happy about the existence of that institute.
By the year 2050, 15 million Americans will have Alzheimer's disease, and therefore we're hoping to be a role model for other organizations to develop throughout the country.
For us to continue the work that we do, please consider making a generous donation through the St. John's Medical Center Foundation to the Institute for Cognitive Health. One of my favorite quotes is from Maya Angelou, and Maya Angelou says this: "People may not remember what you said, people may not remember what you did, but they will always remember how you made them feel."